TB treatment looks long, scary, and confusing. But once you understand phases and even drugs, it becomes simple. Hello everyone, this is Brainless Medico and I am Dr. Manoj. And today we are going to learn an important treatment section of tuberculosis. So let's dig into it.
Basic principles: treat with multiple drugs because single drug can lead to easy resistance of the cases. So if you cause resistance of each drug, then you're causing so much trouble to the patient. So be careful while treating TB. You have to go with the multiple drugs. Treat for adequate duration. Ensure complete adherence. So the goal you have to achieve in the TB patients are kill bacilli, prevent resistance, prevent relapse. If you treat properly and if the case recurs, then the patient has to undergo again same procedure and it will be lengthy again. So you have to prevent the patient from relapsing the disease. So you have to be careful. Then coming to first line anti-TB drugs, the most common thing you are going to learn in your second year pharmacology, HRZD, isoniazid. It is a bactericidal. If possible, I'll go into the pharmacological section in our channel. But if not possible, you can just go and watch wherever the pharmacological section is available. You can just go and brush up your knowledge. Then rifampicin, it is a sterilizing drug. Pyrazinamide, it works in acidic pH. Ethambutol, it prevents resistance. So you can remember it as HRCT. Then coming to standard drug sensitivity TB regimen, it's most important. So in intensive phase, we have 2 months drug will be given, HRZD, isoniazid and all commonly we give. Then we have continuation phase where we give for 4 months. It is H and R. What are the isoniazid and rifampicin? Okay, we'll be giving for 6 months. So total we are going to give in the intensive phase and continuation phase. It will be of 6 months. So intense phase will be given for 2 months. I'm revising again. We will split into 2 phases, intensive phase and continuation phase. So total will be of 6 months. In that 2 months will be your intense phase and continuation phase will be for 4 months. And the drugs will be HRZD in intensive phase and HR, isoniazid and rifampicin will be given in continuation phase for 4 months. Okay, I hope that is clear. Then forms covered by this regimen. So what all type of TB is covered under this regimen is pulmonary TB and most extrapulmonary will be covered. Not all of them will be covered from this regimen, but most of them will be covered. Exception TB meningitis, TB spine, because these two has blood-brain barrier and all. It's difficult to pass through them and it's quite difficult to treat them. So we have another set of treatment. I'll be explaining that separately. I'll be taking TB meningitis in a separate session and TB spine in a separate session. No need to worry. Because even the duration varies, so needs long duration. Then fixed dose combination. See, initially we used to give separate drugs. The patient has to take 4 tablets and adherence was very less. Compliance was very less. So government of India decided to make some fixed dose combination so that compliance will be more and it is easy for the patient even to take the tablets. So fixed dose combination has been introduced by NTEP, given under NTEP program. What is NTEP? National Tuberculosis Elimination Program. Okay. Improves compliance, as I said. Improves compliance, weight-based dosing. So it was even easy for the doctors to give tablets. So what dosage is required? Then important drug adverse effect in medicine. Rarely they ask about these side effects and all, but it's a MCQ point of view. In pharmacology, people has to study very detailedly because each drug is a 5 marker and even complications are separately for a 3 marker. If possible, I'll be covering, or as of now, it is not available in my channel. If you are giving your exams when it is not available, you can just go and watch wherever it is available. I'll be making sure it will be available in the soon. Isoniazid, peripheral neuropathy is the most important side effect. So you should be careful giving to the diabetic patients. Then coming to rifampicin, orange discoloration. So it is not actual side effect, but its benefit of this orange discoloration is like you can ask how the urine is color is passed by the patient. If he is saying it is normal, then he is not taking the tablet. If he is saying it is orange, then compliance is 100%. So this is like a confirmation for a doctor. Then pyrazinamide, hyperuricemia, ethambutol, optic neuritis. Every drug has gives a fixed complication. Patient has to face it. So we can't help but to treat instead of going with the complications of the TB. These are like okay. We have to go take the risk and benefits. Ethambutol, even green color, red green color blindness will be seen. Role of pyridoxine, which is vitamin B6, prevents isoniazid induced neuropathy. So we have to give this to pregnant women, alcoholics, diabetics, and malnourished. Then coming to monotherapy, never use single drug as I mentioned. Irregular treatment, MDR-TB, we have to go with the MDR-TB because the patient has maybe developed multi-drug resistant TB. So examples, drug sensitivity TB, 6 months you have to give. Rifampicin is most important drug. HRZD, intensive phase, ethambutol causes optic neuritis. So we learned how we are going to manage TB, not drug resistant TB. I'll be discussing that multi-drug resistant TB in a different session. But this was a basic treatment of tuberculosis. So this is how drug sensitivity TB is treated. But what happens when TB becomes drug resistant? So don't miss out. Subscribe to the channel, and I'll be teaching drug resistant cases, how you are going to manage them, what are the clinical features, extra you are going to see, and all. We'll be discussing in detail in the further sessions. So don't miss out. Subscribe to the channel. Thank you.